everyone and welcome to today's YouTube on fillers. So that is the magic B. Magic A, I always call it Botox, and magic B is fillers. Now fillers, as the name suggests, is to fill, but this could be misleading because fillers are used not just to fill, but they are also used to lift and to contour. I wish we had another name for that, but we'll stick to fillers. There are few kinds of fillers in the market. We have something which is called Sculptra, which we don't get in India as yet, but the content of that is polyl lactic acid. We have something called Radius. Again, we don't have it in India as yet. The content of that is calcium hydroxylapatite. But what we have in India is probably the best among all of it, and that is hyaluronic acid. Now, hyaluronic acid fillers are my favorite, and the reason being, it is a substance which is naturally present in your skin. So yes, the result that you get with hyaluronic acid is going to be more natural than anything else. Second, it is something which is temporary. Yes, it's temporary, but then because it is temporary, it is also very safe. So you could take it out if you don't like it, plus it anyways goes away with time. And the third and the most important thing is it reflects light. Now, why this property is important is I will tell you more about it when we are injecting on a patient. But when you reflect light, you overall can contour better. Remember when girls put their highlighters, they put on the cheek, they put on their nose. So these are all the places where you could put your hyaluronic acid to give you the natural contour. So you can have a blush line early in the morning and you don't really have to look for it. So we will go to our patient today who is a young girl, and we're going to inject in her to see how we could make her more youthful and a little bit more glamorous. The face is always, we have two parts, right? 1 and 2. Also remember, no two sides of a patient's face are similar. They're never twins. They're always sisters. Bring this point across to your patient when you're injecting, because they tend to say that your one side of the face is looking different from the other side. So actually, there is this one study which shows that when some faces had been studied, there were very few faces which were identical. And among the faces studied, they saw that Denzel Washington's face was someone where one side could actually sit on the other side. So that is the only face where two sides are twins. The rest all are just sisters or brothers. So we have a young girl out here, and she's all of just 25 or 26. So does she really need fillers? Yes. A filler would make her look a little bit more glamorous than what she is. So today we are going to have a candidate for glamorizing the face and not just anti-aging. Remember, a face has multiple levels. It starts with the bone. We have fat pads on that. Then we have the muscle. Then we have some more fat pads, and then we have the skin. Bone is where the structure lies, and as a person ages, this bone shrinks. And because of that, all the layers on top of the bone, they start falling down. So the idea is to build up the structure at the level of the bone. And here, we are building up the structure at the level of the bone to give her a better contour. Now, when you build up on the bone, when you have to go right down there, we need a product which is robust, and we need a product which is not going to migrate. So we don't want it to go from one level to the other level. So I use Juvederm products made by a company called Allergan. And here, the product of my choice is something called Voluma. It's a high G prime filler which will go sit where I want it to sit, and it will not migrate to the other levels because I don't want to volumize, I want to lift and I want to contour. So choosing the right product is extremely important. We will have subsequent videos in which we will talk about how I may use another product for filling up, maybe a lip or sometimes contouring the chin. But today we are going to use Voluma to contour the cheeks, which we call as the mid-face contouring. So what is the first step that you do before you start injecting? Everything aside. 1, take a picture before you inject, because a before-after picture is extremely important. Remember one thing, the results of hyaluronic acid are so natural that the patient can sometimes forget what they were looking like earlier. So take a picture before so that you can show them what you've done for them once the procedure is done. Now, once your before picture is taken, always clean the face completely with some clinical spirit. Important to clean the entire part of that face and not just the area that you're injecting, because you could have some latent bacteria elsewhere. So clean it, mark the points you want to inject on, again clean it with clinical spirit, and then begin to inject. When you're injecting, knowing the anatomy of the face is extremely important. So you may feel that, oh, the doctor is just giving 2 points. But these are the points which we have isolated after knowing where the anomaly is and where the danger zones are. So sound knowledge of anatomy is extremely important before you pick up the syringe. So get your anatomy in place, get your no-go zones in place, and then pick up the syringe. We finished cleaning the face, and now it's about marking. Now what am I going to do here? Like I said, I want her cheekbones to go up. I want to create that blush line and give her a contour like the Uji curve. So the structure, anatomical structure out here which I'm going to palpate is a zygomatic arch. So we will palpate the zygomatic arch. My first point will be on the zygomatic arch where I can give it a pull. My second point of injection would be on the prominence of the zygoma. So zygoma is a bone and I need to know which is the prominence of the zygoma, and that will be my point number 2. There are a lot of ligaments on the face too, and these ligaments are structures which hold the skin to the bone. So when I'm going to inject, I'm going to push the skin behind, so that somewhere I'm pushing the ligaments behind, and I'm going to put my product medial to this ligament, so that that's like a doorknob. It lifts the face upwards. So knowing the position of the ligaments along with the bone is also important. Now these are the magic fingers, like I say, that when you lift, you're kind of lifting upwards. So follow the same action when you're injecting and put your product medial to your fingers, so you're not going wrong. Also, this is an area where we have very important anatomical structure. I can say very 2 more times, very. We have the facial artery, and the facial artery is like a transverse facial artery, and we don't want to go there. So we have to know the marking of the transverse facial artery. We need to know the course of the transverse facial artery and then inject. So once we have all this in place, we start the injections. Important point, go slow. The slower you go, the safer you are. A slow injector is always a good injector. Also, when you go slow, you know if you're going wrong. And when you're injecting, see what you're doing while you're injecting. So how much do I inject? It's like when I'm driving, I don't want to look at the steering wheel. I want to look at the road. I need to know where I'm going. So when you're injecting, see what difference you're making while you're injecting, and you will have natural results. Once I have done one side of the face, I will make her sit up. I will compare one side with the other. Immediately you will see that one side is narrower, a little bit more lifted than the other side. And then I try to match this side on the other side. So 2 sides will not have similar injection points and will not have similar quantity of product used. So it's important, do one side. Now I start with the right side. Why? Not rocket science there. I'm a right-handed person, so I start with the right side. If you're a left-handed person, you could start with the left side too. Then we move to the second side and we inject, trying to be similar to side number 1, because we want some kind of equality there. On her face, Mansi's face, we've injected around 2 ml of the product, 2 ml of Voluma, around 1 ml on each side. We also are injecting a little bit at her piriform fossa, which is the nasolabial angle. If you see, she has very deep folds, and after we inject it, we soften the folds a bit, which also makes the face look a little bit lifted. So you'll need to know where to inject depending upon the individual's face. What are the aftercares? Once she's done, I will say that the product will take, say, roughly around a week to 10 days to settle in. She can go back to normal. As you see, there are no telltale signs that something has been done. She can go for a party tonight. But I'll say on the injected points, be a little bit gentle. Don't rub it too much. When you're sleeping, don't sleep on your face. And yes, at night we could probably move on either side. So keep some soft pillows on either side. So when you move, your face goes on a soft pillow. So it's not on a hard surface and the product does not move. Other than that, there is practically nothing I'm going to tell her. There are no oral medications I need to give her. So I'm not putting her on any antibiotics. She's free to go and enjoy, and no one knows that she's done anything. So that's how a good filler result should be. There should be actually no bruising. If you're going slowly, you're not going to bruise, and you're not putting too much, so you're not going to look like a filler monster.